Hi, everyone. Pete Schooner again from Ohio Today Magazine and Ohio University's Alumni Association with another video chat with this time Dr. Paige Gutheil, primary care physician in West Columbus, Ohio, and an alumna of Ohio University's Heritage College of Osteopathic Medicine, where today you are also an assistant professor of primary care medicine. Dr. Paige, I hope I can call you that. Thanks so much for joining us today and sharing some of what I must be are some of your sort of extraordinary experiences over the last month or so.
My pleasure.
Great. So yeah, to get started, could you tell us just what it's been like sort of day to day for you with your practice in particular? And if you want to go back to sort of when this all really started to be more of an issue locally, feel free. But I'm just curious sort of what it's like being, on the front lines, so to speak, as a primary care physician.
Yeah, absolutely. Things definitely have evolved, and that's the theme in this. As we get more information and everything seems to constantly be changing, right? And so when we first kind of started to wrap our heads around what was going on locally, my patient population is pretty unique in that I run a direct primary care practice. So I partner with my patients on a membership basis as opposed to seeing them using their insurance visit by visit. So in my particular practice and in that model, we use things like telemedicine and text and email. And so I have a community that I really can wrap my arms around already. And so in that aspect, my practice is a little unique than what I hear from my colleagues because I was able to reach out to everyone and say, okay, this is what's going on. This is what we're hearing. These are my recommendations, which certainly are aligned with, CDC and the Ohio Department of Health, but also my recommendations probably tended to be a little more aggressive earlier just because I was getting the information in and kind of interpreting it based on my small group. And so that's kind of been the name of the game all along, is not only partnering with patients at an individual level, as far as answering questions about how they're feeling, what's going on, but reaching out to the community and my social media following, and just doing what you hear a lot of us doing now, which is, influencing that circle and educating people about, not only the nitty-gritty of symptoms and how do I treat this, but social distancing and what does it mean to the infectivity of a virus and the healthcare system concerns and what's the why behind all of this. So yeah, my life has kind of been like putting myself out there to the community and to my patient group, kind of leading the messaging, and then also answering a lot of patients' individual questions. And now, I have a handful of patients who have already tested positive and ushering them through the navigating how do they handle their symptoms at home. Do we need to see each other in person, or can we do a video visit? And then ultimately, do we need to escalate care to a hospital level?
Sure, that's so interesting. And just, sounds like just by the nature of your practice, you are already really set up to be in an ideal situation when all of this came about, just with a lot of telemedicine and using technology in those ways to get information to people. I'm sure almost all of your patients wanted to hear from you and yeah, sort of know what to do, get that advice. So tell me a little bit more about what that direct advice is. Maybe not necessarily those who are infected, but just in general, what are you telling your patients? And what should we all be doing? What advice do you have for the whole Bobcat community?
Yeah, I think, it's important to kind of recognize that everybody kind of wraps their head around this in different ways. And in a lot of ways, we're all going through these stages of corona. I call them, like you hear about the stages of grief, but the stages of corona, and kind of saying like, what does all this mean? What should I do? Is this really a big deal? Is it not a big deal? How does it apply to me? And so the first thing, I would tell everyone is just don't be shy about, leaning into more information, because I think, trusted information is power. And don't feel bad if, you're having all the feels, throughout all this, because everyone's going through this different level of acceptance and different coping strategies and different phases as we go along. And so early on, we talked about the basics of protection, and those basics really are hand washing, as we've heard so much about, hand washing frequently, not touching our face. Everybody, including myself, thinks you never do it, but you really have to have a conscious thought about, not touching our face. Being conscious about keeping our household clean and not obsessing about things, because our emotional health around this is just as important, if not more important, than physical health in a lot of this. But keeping those frequently touched um, items wiped down, and then just being mindful about how we're conducting ourselves in public. And so early on, that was related to being around large groups. And then, depending on a person's individual risk, I was telling people who were at high risk to stay home, sooner than even we got the stay at home, orders from the local government in particular. And so as things have evolved, you've seen those recommendations go from kind of the simple hygiene techniques and being aware of your symptoms and kind of staying to yourself if you have symptoms, to really staying to yourself, period, right? And so we hear a lot about physical distancing, which honestly is the best strategy we have to mitigate this and to slow the spread. And so keeping, and no matter what we do, keeping that 6 foot distance, even if we're doing essential things like getting outside for exercise, or going to the grocery store, conducting ourselves in a way that I call it tactical prevention. We conduct ourselves in a way where we kind of are aware of other people and aware of ourselves, so that we can keep our distance. And now I think, even, we're moving maybe to a little more extreme, where I've advised patients in my community to really think about who is your pod of people. Or I've heard people call it, who is my tribe of people? And so my tribe is immediate household. Now, sometimes your tribe has to be someone outside the immediate household, like essential workers that need childcare still. And so you have to have those conversations about, gosh, anyone in my household or outside my household, I'm not only concerned with them being around me, but I'm concerned about who they're around. Because if you're around, if I think, oh gosh, I'll just have this one person over for dinner, but that one person 2 days ago, was in a larger group, you're exposed not to that one person, but that group of, 10 people, and then the 10 people, and the 10 people. We've all heard about the, degrees of separation. So now I think everyone is really starting to wrap their head around, how do we really keep to our pod of people, but yet stay connected? Reach out to people virtually, text people, call people, FaceTime people, be of help, stay connected, but stay distanced.
Sure, and I know personally I've experienced a lot of that. I've talked to people more in the last month than I have maybe in the last year, and so I think that is a silver lining. I think it's a real positive, and for me on a personal level, it's great for that mental health factor, the staying connected, checking in on people, and then just having that socializing, even though we're physically distant. And I know, to me, it sounds like, this all goes to sort of the whole health of an individual. And I know you use that term in your practice. I'm wondering, can you maybe tell us a little bit more about that? What do you mean by whole health when you take that approach with your patients, and how can we keep that in mind as we all go through this?
Yeah, absolutely. So, like you mentioned, I teach in the Heritage College of Osteopathic Medicine. And so, what I call whole health really is a very osteopathic philosophy. And it's the philosophy of health that takes into consideration that our health, we often talk about mind, body, spirit, right? But I tend to call it mind, body, spirit, and life. So, we have to have a very holistic way of looking at our internal health, our mindset, our biochemistry, the structure of our body, but we also have to consider how we are influenced by our environment and our life. And so what are the health of our relationships? What are the health of our physical surroundings? What our financial health and resources? All of those things influence our health and really, to me, represent whole health. So when I talk with my patients and, put out information on a blog or, whatever, I find myself really gravitating towards those external factors and mindset factors, which have such a strong influence on our physical health, for one thing. And they're the day-to-day things that we think about. So one of the unique things about this situation is just it's affected everything, right? It's affected our mindset. We have new worries to think about. It's affected our physical environment. A lot of us are now working at home as opposed to, in our nice, tidy office that we had control over. We have cats and kids and, things running through our office. Certainly financially, everyone has finances on their mind, and relationships, when we're not able to maybe be close to our loved ones as much as we would like, or maybe we worry about their health status. So that's really, I think it's important to think of all those things, not in a way that overwhelms us, but in a way that acknowledges that, we have all of these things to consider. And, we can't, Rome wasn't built in a day. We can't improve, the situation overnight, but we can pick one thing to kind of think about and improve every day. And so a lot of us, I think, are leaning on relationships, like you mentioned, as a real bright side of all this.
Great. Thank you so much. Thank you again for taking the time to talk to us and share, just what it's been like for you and this great advice. And, just really on behalf of Bobcats everywhere, thank you for doing what you're doing amid this really unprecedented circumstance and crisis. We really appreciate it, and just continue to take care of yourself, take care of your patients, and hopefully we'll all see each other again in person, in brighter times.
Yep, for sure. Thank you. Be safe.